On this edition of Veterans HealthWatch, we'll learn about pre-diabetes, what it means, and what you can do about it. So please join us. Welcome to Veterans HealthWatch, a program sponsored by the Veterans Affairs Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans. I'm Kenya Griffin. Today we're going to talk about pre-diabetes, type 2 diabetes, and what you can do to avoid being pre-diabetic and what you can do to manage your diabetes. Joining us to tell us more is Dr. Nanette Steinle, the Chief of Endocrinology and Diabetes Section at the Baltimore VA Medical Center. Thank you so much for joining us.
You're welcome, Kenya.
Well, let's start with a discussion or a brief overview of type 2 diabetes. That can be kind of confusing for people.
It can be. When we use the word diabetes, we like to distinguish type 1 from type 2 diabetes. Type 1 diabetes is usually a situation where the body produces a protein, and we don't really know why, but in response to infection or some other environmental exposure, that causes the cells of the pancreas that produce insulin to stop working. And in that case, the body is unable to produce the vital hormone insulin to help regulate blood sugar. Often it happens in childhood, but not always. In the case of type 2 diabetes, the condition occurs because the cells of the body are overwhelmed, usually from consumption, excess food consumption, or not enough activity, so that the body has too much glucose. And in response to that, the cells in the pancreas that make insulin start overproducing insulin, and we call that insulin resistance. And at some point in time, those cells can't keep up, they start to fail, and as a result of that, the blood sugar levels rise. And when that happens, we call that type 2 diabetes.
Okay. And I know today we want to focus on prevention. I know the VA Maryland healthcare system is very big on preventing certain things or helping veterans to maintain a good level of health care. Can you tell us about pre-diabetes? We hear that term being used more often now.
Pre-diabetes is a situation where the blood sugar levels are slightly above normal, but not quite as high as the cutoff for type 2 diabetes. And that cutoff is actually a blood glucose level of 126 milligrams per deciliter. So why do we say, well, somebody with a blood sugar of 126 or above has diabetes, but somebody with 125 or 124 doesn't have diabetes? So the reason that level was established as diabetes was at 126 and above is when we start to observe complications from high blood sugar. And the area between a normal blood sugar and fasting would be less than 100. When the blood sugar is between 100 and 125, we call that pre-diabetes because it's higher than normal, but it's not quite to the level of diabetes. And the good news is that a large study was conducted several years ago, in the late 1990s, in fact, where the investigators wanted to determine if someone were to engage in a healthy diet and be active, could we prevent the progression of pre-diabetes to diabetes? And people throughout the United States were enrolled, they were tested to determine that they had pre-diabetes, and then they were randomized to either an intensive lifestyle program where they met with a registered dietitian once a week for 12 weeks, and then monthly thereafter for another 4 to 6 months, versus taking one of two medications or usual care, which was, okay, you your blood sugar is a little bit high, you're a little bit overweight, you should, change what you're doing. And what that study showed was that with lifestyle changes, yes, the progression from prediabetes to diabetes can be avoided. The risk of progressing to diabetes was reduced by about 60% in the people that were studied. And so that was great news. And the other good news is that the changes that the participants in the study were asked to make were what I would consider rather moderate. They were asked to walk for 30 minutes most days of the week, and the average was a 30-minute walk 5 out of 7 days.
Okay.
They were asked to pay attention to the caloric content of the food and reduce the caloric energy to slightly below that which was estimated to be their body's requirement, and to avoid saturated fats. And by doing so, the study was able to actually be stopped early because the benefits were so pronounced.
Yeah, so noticeable. And we hear it. I've done, I don't know how many of these interviews, and usually the prescription, so to speak, is change your diet, change your exercise, change your lifestyle, and you see huge benefits. But we know that some people, unfortunately, pre-diabetic, and we heard from you what we can do to avoid becoming diabetic, and they still become diabetic. I'm not sure if they follow this, the guidance to improve their lifestyle. What happens to cause some people to still become diabetic?
There are a lot of factors, and what we're really understanding now is that probably many of the factors that lead to the situation of becoming overweight, risk for diabetes, start in childhood. So it's learning healthy habits from the beginning. Some of it is genetic. However, I would also like the viewers to know that in the diabetes prevention study that I mentioned, they asked the question, well, there are many variants that have been shown to increase the risk of diabetes. By variants, I mean genetic variants. So they said, let's take the blood that we have from the people that participated in the study, let's check for these genes. And they checked for 34 common genes. And what they found was that even among the people that had the highest burden in terms of genetics for risk of diabetes, if they engaged in healthy diet, were active, their risk was still significantly reduced. So even if we're programmed genetically to be at risk for diabetes, healthy lifestyle is still beneficial.
Still the answer. Okay. So can you offer some practical tips for those people who are pre-diabetic?
Very simply, one of the terms that we try to use and help people understand is in terms of activity, to find ways to reduce periods of inactivity. When I use the word exercise, sometimes people cringe and they think, oh, I can't exercise. I have pain in my knee or my back. And so think about how you spend your day. And if you have, for example, a situation where you're at a desk, what can you do to be more active? Get up every 10 minutes and take a short walk. One of my patients bought one of those machines that you can pedal and put that under the desk, and she was able to reduce her weight by about 20 pounds. And so that's one person's story. But I think if we evaluate how we spend our time and what we do during the day, we can work even small amounts of activity into our day to decrease our periods of inactivity. And the studies also show that, for example, a 10-minute walk 3 times a day is probably just as effective as a 30-minute walk once a day. So building these small things in can be helpful.
And we know the VA Maryland healthcare system offers help to those veterans who are trying to make those lifestyle changes. Can you tell us more about the services for those veterans?
The VA sponsors a lifestyle program called MOVE. That is a group-based situation where they have various professionals that come, the registered dietitian, exercise physiologist, behavioral health specialists. They meet with the veterans on a weekly basis. That program is to some extent modeled after the Diabetes Prevention Project and other studies that showed what methods are effective in helping individuals achieve a healthy lifestyle. Some patients say, well, I really don't want to come to a class. I have a job, I'm busy working. And for those individuals, we offer the Tell and Move program, which is conducted over the telephone. So they receive a phone call, they receive information about the program, and they meet over the phone once a week with their coach. And so the program is very flexible. We have also continued the diabetes prevention program through a class-based system, and if your viewers are interested in that, they can contact the section of diabetes and endocrinology and learn how to become enrolled in the Diabetes Prevention Project.
Well, thank you, Dr. Steinle, for sharing this information. Very hopeful and encouraging information that we hope our veterans and their family members can follow. We're going to take a short break, but when we return, we'll hear from a veteran who's actually in the pre-diabetes program at the VA Maryland Healthcare System. So please stay tuned. Have you heard that the Baltimore VA Medical Center parking garage is under construction? Where will you park? Don't worry, we've got you covered. Let's go. In late February, we'll start relocating parking to the Metro West parking garage, just 2 blocks from the VA Medical Center. From the VA garage on Green Street, you can get to the temporary parking site in just 4 easy turns. Just look for signs like this. Once there, you'll see familiar parking attendants who will ask for your VA identification card or your appointment slip before granting you access. Thank you, sir.
You're welcome, ma'am.
The Metro West garage will be open 24 hours a day and will be patrolled by VA police and security. After you park your car, you can wait for a shuttle in this warm and dry shelter. All shuttles are wheelchair accessible, free of charge, and will drop you off under the breezeway of the medical center and pick you up again after your appointment. You don't need reservations to ride the shuttle. If it's a nice day and you decide to walk just 2 blocks to the medical center, you can pick up a pedestrian map like this. And if you have questions about parking and valet service, there are lots of ways to get information. You can go to our website, or you can go to the information desk inside of the medical center, or you can call 410-605-7103. We know your time is valuable, so we ask that you arrive at least 30 minutes earlier for your clinic appointments during this time. And we appreciate your patience as we work to make repairs to the garage for your safety. We're looking forward to the reopening of the Baltimore VA Medical Center garage. Welcome back to Veterans HealthWatch. Before the break, we learned about pre-diabetes, and now we're going to talk to a veteran who's in the diabetes prevention program at the VA Maryland Healthcare System. Mr. Wykel Carter, thank you so much for joining us.
Thank you for having me.
Mr. Carter, please tell us why you joined the diabetes prevention program.
Well, I was having problems with my weight and everything and body pain, but the doctor recommended me to get into the program. And I kind of like, the first time she told me I didn't really get into it. Then the second time she mentioned it to me, so I got into it. And it helped me a whole lot.
So how are you doing? I was going to ask, how are you doing with the program?
I'm doing great. I love it. It helps me a whole lot. It changed my way of eating and exercise and everything. I'm doing great.
Can you tell me one thing you learned from the program that kind of surprised you, something you were doing for years and then you learned in the program, okay, maybe I shouldn't do this?
Right. Well, my eating habits, that's the main thing. What I was eating and how I was eating, how much. And they changed the program changed me about how to eat, what to do, how to eat good, check your calories, the calories on the labels and food labels and everything.
Yeah.
And exercise. That's one thing. I used to play ball and everything, but I never thought exercise would be a big help in my health. you know,
Yeah.
as far as that.
And I know that there's a person there who works with you who's been a big encouragement, who works in the program actually with all the other veterans. Tell me about how this person in the program helps to encourage the
Miss
veterans.
Pinole, she really helps me a whole lot, you know, because we interact a whole lot, and she tells us a whole lot of information, and we can ask her questions, you know, that maybe some structures might not want you to do, but she let us ask all kinds of questions about our food, our habits, what we should do, and how we should do it.
That's good for the veterans to know, because like you said, you resisted a couple of times.
Yes. You know,
but to know that there's someone there to answer your questions and help you, that's a great point.
Right, and like I'm saying, you know, she taught us motivation, you know, how to stick to your diet or exercise and be, you know, real good with it.
Mr. Carter, you mentioned your weight loss was one of the benefits of this program. Can you tell us how else in other areas have this program helped you?
Well, it helped me in my sleeping, because I had trouble sleeping and body aches and everything. And the program, after I've been in the program a while, as I was going through what I supposed to do, like far as eating and all, it helped me to sleep better. And my cholesterol levels went down, even my blood pressure. All that, all the problems I had, and my blood pressure, my weight, cholesterol, everything got better.
And I think it's important for veterans to know what you did and to know that you've been doing this for a little while. It's not just, oh, it's been 6 months and then you're going to fall off the wagon. How long have you been living this new and healthier lifestyle? And tell us about a few of the things you do every day to make those improvements.
Okay, I've been in the program about a year and a half, well, close to a year and a half. And to keep me going, you know, I try to, you know, things I used to do, I try to change that, not to do certain things I used to do. Like I used to go to the store, to the dollar store. Now I go in there for one thing, I come out with a whole bunch of bags of junk. And so I just stopped doing that, going to the store and doing that. But I go to the market, I do market myself. I only let my wife do it, I do it myself.
Because you've learned now the right foods to
eat. And she likes certain things, but I like, you know, trying to stick to the floor mat that they get me to do. So that's what I'm saying. And I'm trying to get her to get on board too.
And you just keep working at it. And what about your exercise? What type of exercise do you do?
I walk twice a day, and I got my meter. I keep steps, and I do about my goal is 7,000 a day.
7,000 steps.
Steps a day.
Okay.
But Miss Pinole, she said if you do 5 or 6 steps, 100,000 steps, that would be. But my goal is to do 7,000
steps
a day.
Okay.
So
and you just walk.
Yeah, I walk. Walk twice a day, in the morning and the evening with my dog.
Okay.
And we walk about a mile and a half every time, twice a day.
And that's what the doctor was telling us earlier. It's those simple, consistent lifestyle changes that makes
be consistent to what you're doing and everything. Like your food, eating your food, be consistent.
Okay.
Be consistent with your walking too.
Right. And would you recommend the diabetes prevention program to another veteran? What would you tell someone who was sitting on the fence, not quite sure? What would you tell that person?
I tell them it's a good program to get into. And like I tell him, I wore 255 pounds when I started the program. Now I'm down to like 195. And I say I lost about 55 pounds. And the program is good to help. You know, it'll help you. And you're losing your weight, your cholesterol, your blood pressure, everything. You know, that it really helps.
You can't beat it.
Nope.
Yeah.
I would recommend it to all the veterans to get involved, to try it at least one time. Yeah. It'll help. And if it can help me, I know it can help them.
Well, Mr. Carter, thank you so much for being here with us.
No
Congratulations.
Thank you.
Stick with it. We're going to take a short break, but when we return, we'll hear from a doctor who works with our women veterans to talk to us about the treatment available for women veterans with diabetes. So please stay tuned.
It's important to get a new flu shot every year. It's very easy to do, and it can protect you or a loved one from getting sick. People who are at high risk for the flu are those who are over age 50 or those who have underlying heart or lung conditions.
The flu vaccine is offered free of charge. We do the vaccination in various clinics.
You don't need an appointment. You can walk in and get a flu shot when you show up. Thousands of people die from this and is preventable by a simple vaccine.
Welcome back to Veterans Health Watch. We've been talking about diabetes and pre-diabetes, and joining us now to tell us how these conditions affect our women veterans is Dr. Catherine Starpoli, the chief of the Women Veterans Health Clinic at the VA Maryland Healthcare System. Dr. Starpoli, thank you so much for joining us.
Hi, Kenya.
Let's start with an overview of the services or what you provide for our women veterans at the VA Maryland Healthcare System.
Okay, we have a growing population of women veterans, and 1 in 10 of our veterans are women at this point, and in Maryland it's 1 in 9. So, and that has been steadily increasing over the past 20 years. So we have adapted to offer a lot of services to help out specifically our women veterans, who used to be a minority population but are really growing, and over time will be fully integrated into the veteran population. We have a separate women's clinic where we offer comprehensive health care for women, although many of our women are seen in the primary care clinic and come to our women's clinic for their gynecologic care. So we offer all of those things for women. We offer smoking cessation, gynecologic services through our gynecologic surgery, osteoporosis screening. We offer vaccinations, care of chronic diseases, and care of acute diseases as well.
And we were talking about diabetes and pre-diabetes, and I understand that women have a hard time accepting the diagnosis of diabetes. Can you tell us more about that?
Well, I think for women, first of all, our women veteran population is younger than our male veteran population. And a lot of them are working in school, they have children, parents that they're taking care of, and to accept a diagnosis of diabetes can be hard because they have so many things on their plate. It's hard for them to really attend to their own health care. So it can take some time for people to really be motivated to make the lifestyle changes and possibly medication changes that are involved in caring for diabetes.
And you mentioned that you have a program designed specifically for the unique needs of women veterans. How does that relate to the diabetes services you provide for these veterans?
Well, we have a lot of services that women can take advantage of. We have nurse visits, so we have a lot of availability in terms of timing of visits that women can come and meet with our nurses to discuss our diabetes care. We focus on education and management as well in conjunction with the physicians at these visits. We have mid-level providers as well, nurse practitioners that are specifically taking care of diabetic patients, as well as pharmacists, clinical pharmacists that can also help to manage medical changes with diabetes as well. We have a lot of services that we offer right in our own clinic that we can usually give same-day visits with, including retinal screening, eye screenings for veterans, nutrition education we can do as well, at lab testing, of course, and we have pharmacists that can do medication reviews. We actually have a pharmacist in our women's clinic that is specifically for our women veterans who can meet with them as well by telephone if needed, if they cannot come in because of their busy lives, to help to manage their diabetic care. So I think that's a real plus for our women veterans who are often really busy and have difficulty coming in for actual visits due to all the various obligations that they have in their life.
What recommendation, we talked about pre-diabetes and taking the necessary steps to avoid becoming diabetic. You mentioned that women tend to take care of themselves last, they have really busy schedules, and you have younger veterans who have other obligations. What would you recommend as a clinician, steps that a woman can take to start moving toward that healthier lifestyle?
Well, I think that women need to make the commitment to change, because often it's simple things that can help their health, diet, exercise, sleep, all the things that we heard about earlier in this show, but it does take a commitment for it. I think keeping appointments is something else that really can be helpful, and being in communication with your healthcare providers and taking advantage of all the different services that we offer to help support our diabetic women.
And we know that VA also has My Healthy Vet with secure messaging, and there are other ways besides a face-to-face appointment to have that access to care for those veterans who can't make it to the clinic during those times. What are some of those?
We have phone visits where we can do, we can have discussions about health care that don't need physical presence, where we don't have to examine something. We have also a nurse-run telehealth process that diabetes can be monitored through that. Our pharmacist does telephone care as well. We have the secure messaging where people can report to their physicians their home blood pressures, their home sugars, and we can make changes without them actually physically having to come in and have an appointment. So I think that's a big advantage, the various technologies that we have now in healthcare.
And how can our female veterans learn more about all these options?
Well, they can go to our national website. They can also call to make an appointment through our appointment line. They can speak with their primary care physician, who can also help them navigate all the different services that would be available to them.
Great, because we want our women to take care of themselves.
Yes, we do.
Yeah. They've already put their lives on the line, and we're here to serve them, so we definitely want them to take care of themselves.
Absolutely.
Dr. Starpoli, thank you so much for joining us today. We really appreciate you and all your team does to service our female veterans.
Thank you.
We're just about out of time, but I want to take a moment to introduce a new way that we have for our enrolled veterans to learn how to access the services available throughout the VA Maryland healthcare system. It's our new patient orientation video. Our new patient orientation video consists of 24 short clips explaining everything from scheduling appointments and using the Choice program to specialty care and long-term care options and everything in between. It's available online at maryland.va.gov, and I encourage our viewers to check it out. Even if you think you know what you need to know, you might learn something new. We'll leave you with the welcome clip from the video. If you have questions about today's show or would like to make suggestions for future topics, please give us a call, visit our website, or you can even follow us on Facebook and Twitter. And remember, if you are a veteran or you know a veteran who is not using the VA Maryland healthcare system, please give us a call at 1-800-463-6295, extension 7324, or you can visit one of our facilities. We look forward to serving you. Please join us again next time.
Hello, I'm Dr. Adam Robinson, the Director of the VA Maryland Healthcare System. As a physician and as a 35-year Navy veteran, I would like to thank you for enrolling in our healthcare system. We are committed to providing safe, quality, and compassionate care to all veterans through a concept of care which is patient and family-centered and incorporates our core values of integrity, commitment, advocacy, respect, and excellence. As a new patient, you will undoubtedly have many questions about your care and how to access our programs and services. This video will provide an introduction to the VA Maryland healthcare system, the services available to you, and the best way to access each of them. I encourage you to watch each of the modules and learn how to navigate our system. If you have questions, and I'm sure that you will, please do not hesitate to contact us at the phone number shown throughout the video. On behalf of our dedicated employees and our volunteers, I welcome you to the VA Maryland healthcare system, and I thank you for allowing us to serve you and your healthcare needs.
The Appointment Call Center is a fast, easy, convenient way for a veteran to call in to schedule, change, or cancel an appointment.
You can reach any of us by calling 1-800-463-6295, extension 7333.
The call center is open Monday through Friday from 7:30 a.m. till 5 p.m. If you need help scheduling an appointment, call the call center because we're here to help.